I'll wait for your word.
Okay, you'll be good to go.
Thanks, Rob. Good morning, everyone. It's Tuesday, June 7th, 2022, 9:30 a.m. This is the Mental Health and Addictions Task Force meeting. I'll call the meeting to order. Are there any declarations of interest? Seeing none, if one should arise during the meeting, you can claim at that time. Right to item number 3, we have Summer Kuhneman, Mental Health Lead, Blue Water District School Board. Good morning, Summer. You have the floor.
Good morning.
Good morning.
Good morning. This is my first visit to this task force. So I just wanted to introduce myself. I didn't prepare anything formal in terms of PowerPoint. So I wasn't sure what the group would be looking for from Blue Water District School Board in terms of an update. So I guess I will ask what would be helpful as in our first visit here. And I certainly can give you a little bit of an update around our staff model and some of the additions and changes that we've been making at Blue Water District School Board.
Kim, go ahead.
Hi, Summer. Thank you so much for joining us, you and Dave both. We really, really appreciate it. And I think really the purpose of this task force is to help all of the members around the table to understand the resources and capacity in our community, as well as the challenges that folks are facing in accessing resources and supports that they need, or advocating for family members, etc. So if you can kind of give us a sense of, first of all, perhaps the board's perceptions of both challenges and opportunities, and then help us maybe to understand some of the actions that the board is taking. We did have some questions earlier on about curriculum and what kind of information was being shared with students to help them recognize and stay healthy. So any comments along those lines would be really beneficial. Thanks.
Sure. Well, our mental health team has expanded quite dramatically in the last 4 years. So we currently have 7 regulated mental health professionals who are doing direct service with students in our schools across the district. They've serviced over 600 students this year in that effort. And then our new team will include a clinical manager. Her name is Katie Simpson, and she probably would be the person that will attend these meetings on an ongoing basis. She's just getting started actually today. And part of the need for that addition really was this recognition that the amount of clinical work that's happening in our schools and the demand for increasingly complex students and trying to support and navigate their way through the system. It's becoming more and more challenging, and our school staff is often feeling like they are unable to do that same kind of navigation that maybe they could have in the past. So we are really working as a province, and David talked about this as well, to look at the direction of School Mental Health Ontario around, what does school mental health support look like? What is kind of, who are the students that make sense for us to be able to work within our schools? And then, at what point does it make sense that we really need to rely on our community partners? And so the language that the school board uses is kind of tier 1, tier 2, tier 3, and it looks a little bit different in the school context, as I think it does in other places. So, our tier 1 is our good for all kind of supports. And, there's this increasing recognition that tier 1 interventions, that kind of good for all across the system, is really important. Upstream interventions to support skills and mental health literacy and help seeking and all those kinds of ways that we want to ensure that students at younger and younger ages have good information and good access to social emotional learning, all those kinds of things. So, increasingly our emphasis is hoping to shift to the ability to do more and more tier 1. This year, our mental health workers have really been primarily in tier 2. I mean, that's all they have time for. They're managing very high caseloads, and I think I don't see anybody from Keystone on the call here, but I think there's a recognition that our systems have been fairly stretched and there's increased wait lists, and so we're really, in addition to working with those tier 2 kiddos, mild to moderate mental health needs, we are often supporting a lot of our tier 3 students, and those are the kids in our communities who have the highest amount of needs and often are intersecting with lots of different service providers. So our goal is to really sit in tier 1, tier 2, and to really work with our community partners carefully and closely to ensure that those kids who are presenting with the highest needs are getting to the kind of tertiary care in the right places. But I think the reality is that that's not always the case, and many of our mental health workers are working with really complex kiddos. So that's kind of where we're at. In terms of our tier 1, when you talked about curriculum intersections and, how are we educating students, School Mental Health Ontario has been very, very well funded, and they are putting together more and more and more resources that are, jointly created with educators, mental health professionals, equity advocates, to ensure that they're creating lesson plans and resources that, are really, that we can depend on to be evidence-based, and to have an equity lens. So we're relying more and more on that material, and more is coming every month. So there is, for example, there's K-8 lesson plans with social emotional learning embedded right into them. There are now 6 secondary lesson plans geared to mental health literacy for that are meant for all age groups. And so, our job now at the school board is thinking about, okay, how do we ensure that we're implementing those resources in effective ways? And so that's what we're really looking to next year as our team continues to expand, is, how do we use these amazing resources and ensure that, teachers feel prepared to deliver them, and that there's some implementation planning. So that's a bit of a synopsis of where we're at. I know that there is, there's more and more discussion about even expanding that a little bit further with using mental health, using School Mental Health Ontario, to think about what would a high school's major look like, and that's actually something School Mental Health Ontario is working on right now. What would a high school's major look like in mental health? What would that look like? So we're getting so much support from the province around curriculum development with really, really good evidence-based information that we can rely on. So that's kind of where we're at as a school board, and Dave, you might have other things to contribute to that. I know your school is similar and different, your school board.
Summer, just a couple of things. I just wanted to confirm that Phil Dodd is here from Keystone. And right at the start, you're talking about the mental health service. Like, can you be more specific on that? Is it more proactive or kind of reactionary?
I would say that it's both and, right? Because our schools are experiencing so much increased need, at this point, our mental health workers are deployed through referral. So when schools or parents see that a student maybe is struggling, they are going to create a referral, and that will start an assessment process with the school mental health worker. And that, the intention, when I talk about tier 2, the intention is that we are able to do brief service because we really want to be in that mild to moderate range, and then be able to refer out appropriately if the needs are more challenging than what a school system can manage. But like I said, that's not always achievable right now. And, many of our students require more than a brief service. So like I can tell you that our average, the average amount of times we see students is about 4, but of course that's just an average. Some kids require a lot more access to a mental health worker, and some a little bit less.
Yeah, I just have one more before hopefully there's more questions from the rest of the panel. But what's missing in our system, in your opinion? Like, if you wanted to have more or something related to mental health, what would you be looking for in the school system?
That's real blue sky thinking.
Well, I'm just
yeah.
mental health is obviously it's getting worse, or there's more awareness, or I'm not sure how to put it all together, but there must be something missing. At least from your side, what you think that we need more of?
It's a challenging question because the answer, it's tempting to say resources, right? Because we have increasing needs in our schools, and fewer adults to support those needs. And yet I don't think it's simply just resources. So, we have challenges in our rural communities with families maybe that don't always have access to community supports that would really support the family. And the family that's stressed, that means that their kids come to school with a lot of excess challenge and stress. So, just food insecurity has increasingly become a challenge in our schools. Students with housing insecurity, increasing challenges in our schools. Students who just have a very difficult time accessing those tier 3 community services. That's an increasing challenge in our schools. And that's not just about wait lists, that's just about their ability in families to make that happen for them, to get to places and to be able to participate. So, sometimes those essential community supports that help families end up helping kids. And that's getting more and more difficult in our school. Our schools feel like they're doing a lot of that advocacy because kids are struggling, but they're struggling in families.
Okay, any
and
other
I think that we're working, like, in terms of who we welcome into our school. We get lots of support in our school from Choices. Our Choices counselors come into our schools, which is a big benefit to us. Our mental health and addiction nurses come into our schools and support many of our elementary students, which is a really big support to us. Lots of times we'll hear parents say, now it's just too difficult for me. If you can do it in the school, do it in the school. And we're trying hard to figure that out and balance that, because it's not appropriate for us to do everything at school. But we're doing what we can.
Okay, any other questions?
If I could add one thing, because I think this would be, I know that the behavior team would be very happy for me to bring this forward, but we are seeing many increased needs in our littlest population and in our youngest learners, our kind of K to grade 2, grade 3 group our behavior referrals, or referrals to the behavior team, have increased exponentially this year. So kids just who weren't school ready, who weren't learning ready, and who are showing up really dysregulated. And so, it can be difficult to get that support. What do parents say? We're not sure where to go to get help with this. And our system doesn't have the capacity right now. We don't have the numbers right now to do direct support with little people. And we know that little people benefit from support when it's done with their parents and their families. So problem solving a little bit, working with our community partners. And we've been having lots of good conversations with our community partners around these needs, and are there ways that we can work together. But definitely that's an age group that we're seeing a really increased need in our school communities.
Okay, Kim, you had a question or a comment?
Oh, and I'm sorry, as I think Shirley was there too, but Summer, just wondering on the staff side, do your staff have support and resources beyond the curriculum tools, but just support for them as people trying to deal with this?
Yeah, I mean, that's one reason. I guess our staff is big, so we sometimes divide them into our educators and our mental health staff. When I think about how do we get support, it's one of the reasons we added a clinical manager, is because we really needed to ensure that we were giving good support to our mental health staff, who are, bearing witness to all sorts of really hard things that kids are going through. So it's one reason why we added that position this year, so that was really embedded into our service delivery. And it allows, myself, we've really shifted to doing more and more support for staff, because we know that staff who are well end up doing better work with the kids in their buildings, right? So, of course, we have EFAP and we have all those formal mechanisms, but we're really noticing that our staff are fatigued. I'm sure, like many other people, all sorts of helping professionals, staff that have been fatigued over the last couple of years. And so we're looking for ways to support them and to offer them, a lot more help in delivering some of the objectives that we have for students, right? Just, being able to say, we'll support, we'll walk with you as we do this education to students, so that you don't feel you have to do it on your own.
Thank you.
Summer, can you talk a little bit about the behavior team? Is that done within, like, with your own?
Yeah, so our mental health team is part of Learning Services, which is our professional student support staff. So, in Learning Services, we have psychologists, we have speech and language pathologists, we have special education lead teachers, we have autism specialists, and our autism specialists are part of our behavior team. And, they have some specialized behavior professionals whose job is to go into support school teams to create really good plans for kids who maybe have some unique needs. And more it's becoming obvious in our youngest students that, in addition to sometimes some some neurodiverse challenge that's happening, in addition to that, there's some mental health difficulties. So we're working more and more closely with our behavior team in a way this year that we just haven't in the past, because it's just been a really challenging year for our youngest people, and that's been experienced across the province. Dave could also speak to that, but the statistics around our youngest learners is that they've really struggled, and we've seen that with increased all sorts of data points are showing them.
Okay, thanks. Any other questions for Summer?
Shirley?
Go ahead.
Thanks, Mr. Chair, and good morning. Thanks, Summer, for your presentation. Can you just go through the process, please, of how a family would access a behavioral support team or EAs as additional supports for children?
So the family doesn't directly access our behavior team. A family has the ability to directly access our mental health team. We have, a digital inquiry form on our website that families could use directly. For the most part, referrals come directly from school teams, both for mental health and always to the behavior team. So there's a consent process and a referral process that families would engage with the school team to initiate that kind of additional support. And the behavior team is definitely, like, they have their own, they're part of our specialists, kind of special spec ed plan, and they have all sorts of ways that they support school teams to ensure that we've got strategies in place for a successful day, all those kinds of things. The referral to each kind of professional group within learning services looks a little bit different. So school teams, when I say school teams, are learning resource teachers in our schools. They end up being kind of the on the ground specialists in the school that educators go to, and sometimes administrators go to, where we talk about what are the needs that parents are expressing, what are the things that we're seeing at school, and what makes sense in terms of referrals, both internal and external, that would support starting to meet the needs of this young person.
Okay, any follow-up there, Scott? I think we might have lost Scott. Okay, any other questions? Tara, am I missing anyone there?
No, I do not see any hands. Oh, sorry, Shirley. Councillor Keaveney does have her hand raised.
Okay, Shirley, go ahead.
Thank you, Mr. Chair, and thank you, Summer, for being here and sharing with us today. And I really appreciate the focus on working with the youngest children in our schools, and hopefully having an opportunity to break that cycle and help them see potential and opportunity in their lives. But we've spoken a lot about mental health concerns in our schools, and I'm wondering if you're also seeing that we're experiencing addiction issues with the older students, and how is that being addressed, and is there work being done with our OPP school liaison officers? Do we have enough of them in our schools?
I'm not sure. One thing that our mental health team, because we are kind of small and mighty, we are really, we work really hard to refer to the appropriate resource. So most of our students that were substance misuse within a family is an evident concern, most of those students will get referred to Choices because that is their specialty area. And we have, sometimes it's challenging to get consent for mental health service in those situations, and so that reduces a barrier. So it's difficult for me to comment. I don't have our data from Choices at this point to know what those caseloads have looked like this year compared to last year. So it's difficult for me to be able to comment with any evidence around what that looks like, because we tend to rely on our partners at Choices to do a lot of that work. I can tell you from a tier one perspective, it's something that we're thinking about a lot, is how do we ensure that we're giving good tier one education to students about substance misuse and substance use, so that we're doing a bit of harm reduction. So this year we did some piloting in a grade 7 cohort across one of our schools for some cannabis education with a harm reduction approach. So that's where I think that our focus as a school board will be, because we'll continue to welcome Choices into our buildings and to do a lot of that important work.
You have a follow-up there, Shirley? You're good.
Just a second question, if I may, Mr. Chair. And I appreciate your response, Summer. Thank you. And glad to know that that is in place. Hate to bring this up, but it's so often on my mind when we hear in the news about all the violence in the U.S. in our schools and the terrible shootings and the losses of lives and so on. Are we seeing any kind of increased level of violence in our own schools here? And is that part of the education that you're undertaking to help, try and get ahead of that, be progressive in that area? Is it anything we need to be concerned about? Do we have enough security in our schools?
Dave, I don't know if you wanted to speak to some of these things or not. I feel like you have all sorts to offer here.
Just so happy that you're taking the lion's share of all of this, Summer. I feel like, it's hard. It's always hard to know. Do we have enough security? We've had no large, sort of incidents really. We focus on relationships. That's our primary thing in our system, and I think it's the same for Summer's system. We're trying to focus on having caring adults and having kids understand that all of the adults in the school are, go-to people. Like, we want that to be the case, that they see all of the adults as people who are wiser, kinder, bigger, and stronger, that they can go to. And we're trying to recognize when we see kids who are having a bad day, we're trying to engage them right at the front door, so that if there's something going on, hopefully we're picking up on some of that stuff. You can't ever know, and some kids are not that forthcoming, but we're trying to sort of pay attention to those kids, and that's our way, rather than sort of increase formal security in the schools, which I don't actually see the need for at the present time. I think I have to say I'm really proud in our system of how educators and administrators and my staff managed through this pandemic time, being there for kids and offering a listening ear and taking time away from academics if that was needed on a given day. That's not, sometimes that just can't be the focus, because a kid is not in a learning brain, is not regulated enough to actually sit in class and pay attention. So we have to get them back to learning brain before we can move forward with academics. And I think there's been a real recognition of that, and some patience shown to kids throughout this pandemic. So.
Yeah, I can tell you too, all schools and across the board sometimes have situations happen where things get escalated, and various lockdown procedures occur. And so we've really, in addition to, we know that that's important, but we also know that sometimes that has impact on kids. So we're making sure that we're supporting schools to respond appropriately after those kinds of things, so that, kids know that they're safe at school, because it's really important that they experience safety in their school communities. So we're doing, increasingly we're sending out those messages to systems, because there's been all sorts of things in the news and that sometimes happen in our buildings, that it's important that we do really good debrief, and help educators to know how to support students following those kinds of escalated events.
Great, thanks. Shirley, did you have any more, or you're good?
I'm good, Brian. Thank you.
Okay, Tara, could I just have some clarification? Like, we have Summer and Dave on two different items on the agenda. Do we need a motion at all?
We don't need a motion at all. I believe that Dave likely has some things to add. We do have Councillor Carlton, Warden Hicks, and Sandra McClay Winters in line to speak as well.
Okay, Sue, you go ahead.
Thank you. Just a question. You've referenced summer choices, and I'm not familiar with that. Can you just tell us what that is exactly for the students? And thank you very much for being here today, both of you.
You're welcome. Yeah, they are part of CMHA, and their mandate is to work with young people who have substance misuse challenges or substance misuse within their family that's impacting them. And so they will work with students from all ages up in our high schools, which is wonderful. And so we definitely rely on them to do work with our students who have some challenge with substance misuse, so where that's been identified. So we have 3 in Bruce and Grey County, and I suspect they also go to the Catholic Board. Dave can speak to that, but they've got school assignments and they come into our buildings at least weekly to support students on their caseload.
I think there's actually, and Clark, you can correct me if I'm wrong here. I think there are 4 voices counselors in total. One thing I would say to this group is that, I mean, Choice has been around since about 1989 as part of the addiction services, that outpatient addiction services. When I was a Choices counselor back in the day, and there were 2 of us for the entire region. So Grey Bruce is about the size of Prince Edward Island. You had 2 youth addiction counselors running around counties where at one point we had the highest incidence of binge drinking in Canada, in Grey County. So now you've got 4, and you've had 4 for a really long time, like over 20 years. It's only been 4, and the complement has never been increased. And so there is a lack of resource there. I would say there's been a lack of resource for a long time, and those Choices counselors not only work with young people, they work with parents and work with families, and help to navigate those adolescent relationships, which is very, very tough work. So if there's one thing I would say, you might want to look at trying to increase the level of resource that's available for adolescents.
You're good, Sue? Okay, I should mention now that Dave's kind of in on the scene here. Dave is the manager of mental health services at Bruce Grey Catholic School Board. So we'll just kind of blend both in here if we have questions for both. Warden Hicks, you had a question?
Thank you, Mr. Chair. My question is around, Summer, you used the term tiers quite often. Maybe I'm just not understanding tiers. Could you delve into that a little bit more and explain what the tiers of service are?
Yeah, Dave, did you want to take that? You look like you're ready to jump in.
Well, it's part of a model that it's like a pyramid model. So tier 1 is sort of what's good for all kids. So that's where all of the prevention and education work lies. At our school board, I have 6 regulated health professionals, so 5 social workers and 1 mental health worker who's a member of the College of Psychotherapy. And then I've got 5 core child and youth workers, and they do the bulk of that prevention work in classrooms. So offering mental health curriculum, social emotional learning skills, stress lessons, how to recognize your emotions and regulate your emotions. All of that kind of work happens in group settings in classrooms. And then we have tier 2, which is those kids we know are bubbling a bit. They've got we're worried that there's some more significant issues going on there that we need to address. And so those tend to be seen by our social workers in the system, who do some early intervention work with them and try to identify what the issues are. And then we've got tier 3, which is the kids that require the most intensive support in the system, from what we can tell. And so those are the kids then that we hire tier 2 and tier 3 kids that we are trying to refer out to our community partners. So Keystone gets the lion's share of those referrals. Choices will take on some of those when there are substance use issues present. So it's just that kind of, tiered level of looking at services. School Mental Health Ontario, which is kind of an advisory body for us, they say that we should be living in tier 1 and tier 2, but it's Grey and Bruce counties, so necessity is the mother of invention, as it always has been. We don't have the level of service here that you see in urban areas, and so for sure my social workers are hanging on to kids probably longer than they should at times, doing work because we know that there's nowhere else to send them to, doing work with parents. you know, because our community services are overwhelmed, there's still not a lot. It's very hard to access service for mild to moderate mental health concerns in this community. It has been for a very long time. And we know that that's not our fault. A lot of that is sort of the direction that governments took years ago, and they've moved all of the focus to serious mental illness. I see Naomi nodding her head because she knows this rating scale. And so the top of that scale is to see people with serious mental illness. And so, so we all end up sort of jumping in and trying to support where we can. And we try to partner very closely with our community folks. People don't care what your mandate is. That's the bottom line is, you know, if they're stressed and they're worried, especially about their kids, and you're willing to talk to them, they never ask to see your credentials. You know, they're just happy to talk to you. But we do have to pay attention that we don't get too far out of our lane and take things on that we actually can't support in the school. So as Summer said, we try to stick to that tier 1 work to my child and youth work team, and then the social workers. They're really supposed to sort of stick to some early intervention stuff and assessment. And then if it looks bigger, we're seeking outside support and consultation. So I hope that made sense somewhat, but
That really helps. And Mr. Chairman, if I might, to sort of follow up, is that the right model? I asked this very innocently. Is it the right model that sort of the school at school, their lane is primarily tier 1 and maybe a bit of tier 2 while you're waiting, even if a child looks like they're perhaps needing something more intensive, that it's a holding, you know, they're providing what they can while that child gets to the tier 3 service. Is it the right model that those that schools are sticking to tier 1 and maybe some 2 and referring out for tier 3 and maybe some 2 and referring out for tier 3, or should schools be in the business of tier 3?
Well, that's a big question. I think that a lot of work's been done with Children's Mental Health and School Mental Health Ontario to think about what's the right place and right time for service. There's actually a new document that's been released that was done in collaboration around that. And one of the reasons that tier 3 becomes so important to be able to access specialized support is often the treatment plan requires specialization and requires some expertise that isn't just always possible for us to have at the school level. So lots of that involves kids who've experienced a lot of trauma. And, we in a school, we're doing stabilization, but that's about as far as we're going to go. Disordered eating, for example, has become something that, you definitely need some specialization. For example, just to give you some idea around those tier 3 kids. And we want them to have good access to, psychiatry, all those kinds of things. So, it's an adjustment, I think, because I think schools have done a lot of tier 3 support. But we also want to be ensuring that they're getting the right care at the right time. And that's not always possible in the school system. So I see that we do a lot of partnering. So I can say that, there's some times where kids are at particularly high risk who might have a good treatment plan and a counselor with Keystone, and yet in the school building during the day, their risk level is pretty high. And so we do some assisting and supporting the school system to support that safety planning during the day. So sometimes there's some teamwork that happens, I would say, with tier 3 kids. Definitely. Because they spend the bulk of their time. Hopefully they spend the bulk of their time. The challenge is some of these tier 3 kids it's difficult to engage in school. So, hopefully the bulk of their day is at school, because we know that there's a lot of safety created at school for kids.
I don't think.
Dodd, did you want to jump in there?
Yeah, I just wanted to clarify in terms of Warden Hicks' question, the dynamic around the tier levels was a part of the ministry, the government of Ontario, in moving on mental health. So that's where the tier levels were created. And the implications were that the school systems would deal with levels 1 and 2, and the community-based mental health system would deal with level 3 and 4. And that was supposed to be a mechanism to streamline and divvy up the work in the system. But as Dave and Summer are clearly articulating, you don't put lines on 1s, 2s, 3s, or 4s. And as Naomi and Clark will attest, they see the same within their system. The 3s and 4s are getting into the hospital. They're getting into more severe issues related to that. So it's hard to define a 1, 2, 3, or 4. And the reality is, in Keystone, as the community-based Children's Mental Health Center, we take all levels. If somebody calls Keystone and asks for help, they are seen within our doors. So we see 1s, 2s, 3s, and 4s, and that's just the reality of it. And in some cases, though, as David pointed out, this is Grey Bruce, and we have been under-resourced in children's mental health. And I don't care what anyone says, we have been fully under-resourced in children's mental health for the last 30 years of my career in this organization. I have, when David and Summer talk about their clinical staff, their regulated staff, I think it adds up, was it 7 and 5? So I have 3 more staff than them to run the children's mental health services in Grey and Bruce. Again, it's not like I'm resource rich. My staff are carrying high caseloads, and the continuum just is not there in terms of the resources. So yes, in answer to an earlier question, what could be done to help the system differently? I will say it, Summer, we need more resource. We need more staff. I can't continue to add 5 more referrals that come in today to my staffing group that are already at 45, 50 cases right now. It's just impossible for us to continue in a trend that's going on, particularly right now in the province. And then it's even harder for us to be supportive of David and Summer in downloading those families and children that are in the 3s and 4s. And the reality is the level 3s, typically, they're dealing with family issues. It's beyond a individual young person issue and something that can be managed at a school support level. These are young people that are struggling with severe family dynamic construct issues. And we need to really try to address that. And that takes time. Those are cases that we're not 1 and done. We're not 4 and done. We're in the game for months. And it's a challenge to then open up a case in the front door when we're still seeing all these multiple cases in the back. So yeah, I kind of went off on a rant there, but I know my time in this organization is coming to an end at the end of June. I just felt that I needed to rant a little bit there. It is clearly, in my mind, a resource issue within Grey and Bruce. And I'm not comparing us to any other counties or anywhere else. I'm just saying it's a reality in our work.
Just to give you an example of the amount of time. So, and this harkens back to a question, I think, Brian, that you had about, to Summer, what would you do differently or what's needed in the system? If you have families, you have parents that are under stress, it takes all of their courage to make that first call to some place. And a lot of times they just get a number, like call this place, they might be able to help you. They don't know if it's the right number. So we really have to be the right number no matter what. Every place has to be the right number. Like that whole no wrong door thing, you got to make that come alive. That's one thing, because they need that level of support. And one thing that Keystone's done recently that I think is a brilliant move was to hire, they have a supervisor of intake now. somebody who can really look at the intakes coming through the door and make sure they're getting where they need to go, and that they have a warm handoff from someone. And so I recently had a session with that supervisor because I had a young mom, young single mom, no resources in the area, terrified of accessing services, worried that, you know, she was going to be judged, poverty issues, all of that kind of stuff. And so I was able to have a session with that supervisor and the principal of the school and me sitting with the mom, and so that she could see a face on the other end. She could get used to the idea of seeing that person, hear the resources that would be available to her, set up a separate appointment that she can go. Like, all of that takes a tremendous amount of time. But that's building relationship. And unless you can build some relationship and establish some trust with that mom's not accessing services. So it takes that amount of time and that amount of resource, and that amount of respect for where that young mom is at, no judgment, understanding that she's got, you know, issues with finances. All of those kinds of things need to be in place. And that does take tremendous time. It does take tremendous resource. And I know that Sandra and Clark are both waiting, so I'm gonna be quiet now.
Okay, first of all, Buck, are you finished? You had nothing else? Okay, we'll go to Sandra next.
Thank you, Mr. Chair. Dave, you spoke about your staff being seen as go-to people. Can I ask how you prepare your staff to be go-to people, whereby biases and attitudes are set aside for the betterment of the student?
Yeah, so it's an easy sell with my staff because that's kind of where they live, right? That's the training that they received as social workers and child and youth workers, to put all that judgment aside. The group that we've really been working on over the last 3 years anyway are the educators. And what we're trying to do is increase their capacity. It's not even about increasing capacity because they all have it. They all have amazing soft skills. Like, they love kids. They want to be there for kids. They know what to do. It's just they don't know that they know what to do. You know, so we have to remind them of all of those skills that they bring to the table, that there's no special magic really in what the social workers do or the child and youth workers do. It's not to downplay their skills, but you know what these kids need is somebody to calmly and in a compassionate way co-regulate with them when they are feeling at the bottom, when they are stressed, when something's been going on at home that set their day off. We need those educators to know that when they take a moment to just focus on that single child, when they listen to them, when they validate their feelings, when they give them a hug, that goes a long way to getting them back to learning brain. And so for years, a lot of these teachers have been in this place of, well, I don't know how to do that. I'm not a social worker, you know, I'm just a teacher, forgetting all of those things that they bring to the table. And so one thing we're started on the path with is taking a trauma and attachment approach to all of our work with young people. And so there is a program, you can look it up online if you want. It's called Circle of Security. We've trained all of my staff in a circle of security approach. And we actually had this idea that maybe we get some principal champions to come on board with that. And so we offered it out to them. And to our pleasant surprise, almost all of them signed on to become facilitators in Circle of Security, which is it's a parenting approach. And so Circle of Security looks at what kids need from us when they are at the top of the circle and doing really well, and what they need from us when they're at the bottom of the circle. If they're going to build strong attachment and they're going to be able to move out and feel confident about who they are as people. And so that is something that we had the training this past year, and in the future, we're looking to sort of, you know, send that out school-wide to all of the educators around our system. So it's been really tough to do PD during the pandemic because folks are pretty burnt out, frankly. And we did offer summertime support the last 2 summers, mental health support. This summer, I think pretty much en masse, all of the sort of school boards that came to the table with School Mental Health Ontario and with ministry said, if you're going to give somebody money, give it to community services to offer mental health support through the summer, because our guys are burnt and they're done, and they need their summer to recuperate before they go back again in September. So I don't know. I think a lot of that fell on deaf ears, unfortunately, but we were saying, you know, give it to our community partners. They're the ones we rely on to support these kids when we're not eyes on through the summer. So.
Anything further, Sandra?
No, thanks, Dave. That's interesting and exciting rollout to the educators.
We're not far behind, and Blue Water Circle Security is definitely something that we are rolling around, thinking about how we could implement and train and figure out a way to do that. Because it really is such a wonderful way to teach a refrain around behavior, and to support in ways that can increase emotional literacy and contribute to regulation, to bodies that are regulated in classrooms. So it's a real relational approach.
Great, thank you. Okay, we'll go to Clark McFarland.
Thank you. Just a few points. To reiterate, yes, I think we certainly do need resources. As I've said, we have to vacancy manage here in order to balance. I think with those resources, though, we also have to use them differently as well. I think as all has been a theme in the healthcare system for some time, of integration and collaboration. I think the conversation today you see, and throughout the task force presentations, you see the intersections between various sectors, and it's always a challenge to find a means of connecting smoothly and effectively and efficiently to ensure that people receive, and kids, or if it's adults, whoever, receive the right care at the right time in the right way. It's a constant challenge and something we can't lose sight of. And to that point, I think it would be beneficial, just as a context piece, if the task force had a presentation from the Grey Bruce OHT, because on the health side, that is a huge structural change in the healthcare system that is focused on just that kind of integration. So I think that would be a good piece. The other thing that I was thinking of is, we have been talking a lot about the acuity of things and how sort of the crises, and how can we put out the fires. But stepping back, we also need to take care of the long term. And I think from a municipal and county perspective, it's really important to have healthy communities. And there's some really interesting research on design interventions and how you can build communities. I'm talking, physically build communities to make them mentally healthy, to make them spaces that promote people's mental health and well-being. And so, I think that's something to sort of bring into your minds when you're sitting around the council tables as well, making decisions on your master plan, when you're looking at land use and things. It comes back to mental health too, is having a healthy community. I don't know if I've mentioned it. He's an OT that's doing his PhD over in London, and he's doing it exactly on that. So I can find that reference and send it over. It's interesting stuff.
So Clark, I just wanted to, can you just specifically talk about more resources? If you had more resources, what would that be, and what would you do with them?
Well, a number of levels. I think we would certainly be able to staff up more. We have needs. I think a pressure now is for us is street level service, is having more active outreach and meeting people who are, struggling with a substance use disorder, homeless, and are marginalized. So I think I would like to be able to have a greater complement of staff who are just out there on the streets, engaging people, building that relationship, and sort of that pipeline into service. The other thing is just at another level in the community, we are building our infrastructure as well. Internally here, we've just stood up a quality improvement department, which is allowing us to make greater use of our data, which is allowing us to have data-informed decisions and things. So, that's structurally, that's a really important piece in improving service and being able to plan service in a thoughtful and forward-looking way, as opposed to simply reacting to crisis, being strapped for resources, and just trying to survive, is trying to get ahead of that curve. So, and there again, I think the OHT coming together as a system, we can work together to improve that as well. The health unit has great resources in terms of data. We all have, pockets of data. Coming together and speaking a common language and fleshing out that picture so that we get that full picture is really important, because we all see a sliver of it, but we don't see the whole thing, and we're all working really hard in a really dedicated way in our own space. But again, it's not that they're our clients, we are their providers. And we need to start to structure and work in that way. Right.
Great, thanks, Clark. Okay, we're going to go to Naomi Bodden. Good morning.
Good morning. I echo Clark's words, and I just also would like to add that if there were more resources, I think we need some expertise in some particular areas that are underfunded. So one example is first episode psychosis. We're funded for one position. This is prevention and early intervention of psychosis. These are our younger people who, we're seeing some symptoms that make us wonder if they're going to lead to schizophrenia. And we know if we intervene early, that often we can forestall that direction and have a healthier child, a healthier family. And yet again, we're funded for one position for Grey Bruce. We have pulled together other resources because we think it's so important so that we have 3 staff, but it's still a very underfunded area. Another one for our system is eating disorders. I do believe Grey Bruce is as a whole $50,000 for eating disorders. That serves our child and adolescents and our adult services. Which is, eating disorders is exploding, and it does require a higher level of training, education. I'm going to say we have great clinicians who will do the work, but need that support. They need to be able to refer to someone who has that higher level of expertise. So, so eating disorders as well. And then the other area would be autism. I think Keystone does a great job with and I think Phil would say that's not his primary work, but it does seem like there's a growing amount of children coming through our system who have autism and end up in our adult mental health unit as they age, and it is just so not an appropriate place to provide service.
Okay, thanks for that. Any other questions? Kim, go ahead.
Thanks. I just want to be clear. We talked about the littlest ones and the severity of some of the issues that you're seeing in that group. But I'm just not clear, where does the referral go? If those are tier 3 situations, where are those children and families being referred out to?
We're referring them out to Keystone.
Okay.
Keystone's got the whole gamut and working in partnership with them. The case that I talked about, that was the child is in junior kindergarten.
Okay.
Yeah, we would be the same. We're referring to Keystone.
So
We're to our
Kim,
mental health and addiction nurses.
yes.
Yeah,
Kim,
we're using
so-
them fairly regularly.
Yes, Phil?
Sorry, I was just gonna contribute there a little bit. Keystone is the Children's Mental Health Center for Gray and Bruce County. So we would be one of the first referral out points. Depending on the level, if it's a level 4 and they're actively suicidal, Naomi is seeing them at her ER right away. But technically, they would be coming to Keystone as the Children's Mental Health Center, Gray Bruce.
Thank you. I just wasn't sure if you started at such a little age, so thank you for clarifying.
Yeah, we are 0 to 17, Kim.
Okay, thank you.
Okay, any other questions? Seeing none, okay, we'll move on. I want to thank Summer and Dave for your presence today. That was a great discussion. Next up on our agenda is our next meeting date is June 21st, 9:30 a.m. And item number 6 is adjournment. I need a mover and a seconder. Moved by Dwight, second by Barb. I'll call the question. All in favor? And that's carried. Thanks very much, everyone. Have a great day. Bye for now.